Why is asking me to sign? Hello, Dr. Jyoti. Can you hear me? Hi, Dr. Jyoti. Can you hear me?
Yes, ma'am, I can hear you.
Hi. Nice to see you. Nice to welcome to the GCAR Club first meeting of yours. We'll have many, many more. I'm sorry. मेरा कैमरा थोड़ा सा गड़बड़ कर रहा है. But are your slides ready? Let me give you this thing first. The rights to share. Oh, a minute. Let me share this first, and then I'll give you the rights. How are you doing?
All good, ma'am. How are you?
Good. आप इतनी रात तक क्लिनिक में ही हो अपनी?
Yeah, my OPD timing like this only.
So it goes on till अभी 10 o'clock
Yeah,
तक?
10, 11
Oh
evening.
wow.
Yeah.
Hard working
It's my
doctor, huh? And call me Archana. You don't have to call me ma'am.
thank you, Archana. Thank you.
Hmm.
Sorry, I troubled you a lot because I was not aware about the journal club. I'm
It's
just
okay. It's
writing.
okay. It's your first experience,
Um,
and that's fine.
but
Wait,
thank
let
you
me.
so much. It helped me a lot. And it's very interesting. I found it very interesting.
I know Dr. Pratibha was telling me that you also like you'll be joining as co-chair, so she's gonna talk to you. So we'll be working together. So, but it will be
Wow.
nice experience to work with you.
Thank you, ma'am.
आपके
Thank you.
स्लाइड्स रेडी हैं?
Yes,
ओके.
it's ready.
सो मैंने ना आपको फर्स्ट आई विल जस्ट इंट्रोड्यूस यू एंड देन इंट्रोड्यूस दिस जी कार्स मिशन एंड आफ्टर दैट you can share your slide and then we can start the so we'll start at 12:30.
Okay.
ठीक है, थोड़ा सा मेरा टाइमिंग का गड़बड़ हो गया था.
Good.
हमारा यहाँ पर वो क्या बोलते हैं, टाइम चेंज होता है. सो आई थॉट 10 o'clock विल बी आर 11:30. फिर कल वो डॉक्टर प्रतिभा का कॉल आया, अरे अर्चना वो 12:30 नहीं है, इट्स 11:30 नहीं है, 12:30 है. तो मैंने फटाफट से फिर चेंज किया. लाइक ओके, दैट्स फाइन, दैट्स फाइन. सो आप एक बार अपने स्लाइड्स शेयर करके देखो, हम लोग वो एक रन कर लेते हैं ना.
Yes.
सो मैं स्टॉप शेयर करती हूँ.
Yes.
ओके.
Hmm. My slides are okay.
ओके. सो स्टार्टिंग विद धन्वंतरी.
Yes.
या ये तो हमारे आयुर्वेद के गुरु है, इनको कैसे बोल सकते हैं.
Very true, ma'am. Very true.
Yeah.
Ma'am, you are from India?
Yes, I am from India. I did my BMS from State Ayurvedic College, Lucknow.
Oh, great.
या और उसके बाद
Which
वहाँ पर हाँ।
number of
आपकी आवाज थोड़ी सी ब्रेक हो रही है।
I've been to Lucknow so many times. I love Lucknow.
ओ
Her
रियली?
especially
अगर
the
मुझे कोई
food.
वो बोले ना ऑप्शन कि कहाँ सेटल होना है, सो आई वुड से कि एक बार ही ना हम रिकॉर्डिंग पॉज कर देते हैं। नहीं तो हमारी सारी बातें रिकॉर्डिंग आप ना एक बार ही स्टॉप शेयर करिए, थोड़ा मैं शेयर करती हूँ, देन आई विल इंट्रोड्यूस। तो जस्ट वेट फॉर 3-4 minutes एंड देन
Yeah,
वी विल लेट दिस विल। यस, तो अभी मैं अपना शेयर कर रही हूँ।
yes,
शेयर। कैन यू सी माई स्क्रीन? मिशन एंड
yes,
विजन।
yes.
Okay. Can you see the screen, Dr. Jyoti?
Yes, I can see the
Okay.
screen.
We will start at 12:35. Let's wait for like few people. We'll start and then this will be uploaded on YouTube so people like watch later. So aram se it'll be content will be provided. So let's give it a minute. I think we can start. Hello everyone, welcome to Mars General Club meeting. We have our renowned speaker, Dr. Jyoti Joshi. We are honored to introduce Dr. Jyoti Anand Joshi, a highly respected Ayurvedic physician, researcher, and educator with over 12 years of clinical experience as the chief physician at Joshi Panchkarma Clinic in Panvel, Mumbai. Dr. Joshi has been a leading voice in advancing evidence-informed Ayurveda, skillfully bringing classical wisdom with modern scientific research. Dr. Joshi gained national recognition for authoring the first pan India research publication in JAIM on Ayurveda based management of COVID 19 with a focus on hypoxia. Her continued contributions to peer reviewed research have strengthened Ayurveda's role in integrative and pandemic care. She has been honored for her outstanding clinical work by the Ministry of Ayush and was invited to represent the Ayush sector in a special interaction with Honorable Principal Prime Minister of India. An internationally recognized speaker and academic contributor, Dr. Joshi has shared her expertise across global platforms and continues to mentor students and practitioners, fostering the next generation of Ayurveda professionals. She will be talking about and giving a critical analysis on the topic effect of Withania somnifera, hydroalcoholic extract, and other dietary interventions in improving muscle strength in aging rats. Before we start, let's start with what is the mission of GCAR? The mission of GCAR is to encourage, educate, and facilitate basic clinical and interdisciplinary research in Ayurveda. Our vision is to promote and establish Ayurveda as an evidence-based health science globally. So Dr. Jyoti, welcome to GCAR Club, and and we are honored to have you here. So you may start, and I'll stop sharing, and you may start sharing your screen. Thank you.
Thank you. screen का है।
Hey, Dr. Jyoti.
हाँ,
Okay.
my slides are. Can you see my slides? Am I?
या आप ना स्लाइड शो मोड पे क्लिक कर दीजिए बस. इट्स लाइक
Yeah.
1 2 3 4 5 एनिमेशंस के बाजू में है. So you go on top. So there are
Yes.
yeah. So it's visible to everyone. From beginning you can start.
Yes. Yeah. Is it okay now?
थोड़ा सा इसको enlarge कर दीजिए बस.
Last.
So yeah,
Last.
on your right there's a box, square box, uh, close to the croc X button. उसको बस क्लिक कर दीजिए.
Yeah. It's okay.
I think so. It should be fine. Yeah, it's fine. So I'll just
Yes.
mute
So
myself.
yeah, namaste everyone. This is Dr. Jyoti Anand Joshi. So I will start with the prayer. Ajnanatimirandasya jnananjana shalakaya चक्षुरोन्मीलितं येन तस्मै श्री गुरुवे नमः श्री धन्वंतरे नमः. सो जो आदि वैद्य है उनको नमस्कार करके आज का प्रेजेंटेशन आई एम गोइंग टू स्टार्ट. सो टुडे आई एम गोइंग टू स्पीक ऑन द इन विवो टॉपिक. सो बेसिकली there are very less studies in vivo in the Ayurveda, so I found it very interesting. So uh, I thought I will speak about this topic. So let me introduce myself. I'm Dr. Jyoti Anand Joshi, founder and director of Joshi Panchakarma Clinic, Panvel, Mumbai, India. So today my research paper is from JIM. So it is published on the 9th of November 2021. That is the effect of Withania somnifera, hydroalcoholic extract, and other dietary intervention in improving the muscle strength in the aging rats. So basically, oh, that's fine. Okay. Yeah, sorry. So this is my research paper. So it is from Vandana Panda ma'am, Amol Deshmukh sir, Asavari Hari ma'am, Sneha Singh ma'am, Lal Hingorani, and S. Sudhamani sir. So I would really like to appreciate the all the efforts and pain they took for this, the in vivo study. So rationale and the yeah, so rationale and the intervention and the focused area. So basically, here the author is like in the 40 years, at the age of 40 years, there is a loss of skeletal muscle mass and there is a decline in its function. And for 50 years onwards, there is a 1 to 2% per year. There is a loss of muscle mass and loss of skeletal muscle mass and decline in its function. And the complications are the falls, fractures, functional disability, loss of independent living, and the mortality. So basically, in view of this aging process, this study is designed. So what are the causes? So the causes mentioned by the author as reduced muscle protein synthesis, low protein in the diet, impaired protein absorption, lack of exercise. So intervention is the muscle protein availability. Novel herbal supplement, that is the Withania somnifera, and the resistance exercise. So we'll see in detail about this intervention, and the effect is strengthen the weak and the aging muscle. So this is the rationale and about the paper. Now we'll go about the details of the paper. So you can see in the normal rats, you can see the muscle of the normal rats. So like we have seen in 50 years onwards, there is 1 or 2%, 1 to 2% decrease in the muscle strength or the muscle mass. So you can see after 12 months in the rat, after the 12 month sarcopenic rat muscle, and it is like biomarkers are inflammation, oxidative stress, apoptosis, backs, and increased blood glucose level, and there is a decrease in the grip strength, total protein, and blood glucose level. So here the author is actually like there are 5 groups basically. So first group, there is a Withania somnifera 5 milligram per kg. Then there is a protein cocktail where the author has used the soya bean 1.5 gram per kg with the quinoa 1 gram per kg. Then there is a third group where the author has used Withania somnifera but and this protein cocktail. This protein cocktail means soya bean and the quinoa. Then there is another group where the patient is where the author is used 1 gram per kg whey protein, and there is a resistance group. So resistance exercise. So basically, if we'll see, so there are like 5 compared group aging 12 to 13 months, as we have seen earlier that at the 12 months, the after the 12 months there are sarcopenic, means that there is a muscle weakness in the rats. So compared group aging 12 to 13 months, and control group, they have there are two control group where the young rats are there that age is 2 to 3 months, and the another age group is 12 to 13 months. So we can see here. Then what are the how they have assessed this Withania somnifera hydroalcoholic the effect, and this other the control other the 4 groups. So basically they have did this test on day 1, day 14, then day 28, day 42, and day 16. And there is a grip strength, blood glucose level, total protein, inflammatory markers like CRP, interleukin 6, then MPK, glutathione, antioxidant enzyme, then the bicep brachii muscle histomorphological study. So basically, all grip strength and blood glucose level is monitored from the day 1. Other tests were done after the 16 days. So there is a increase in the grip strength, total protein, then blood glucose BCL, and there is a reduction in the inflammation, oxidative stress, apoptosis, backs, and blood glucose level. So this is the herbal extract of the Withania somnifera. So basically, Withania somnifera. So it alleviates the age-related muscle weakness. How? So it is anabolic, antioxidant, anti-inflammatory, then insulin secretogenic, anti-fatigue effects. It strengthens the weak aging skeletal muscle, anti-stress, adaptogenic activity, anti-inflammatory effects, then potent antioxidant effect, improves the muscle mass. So I have highlighted the where the muscle related things are there. So muscle weakness, then it strengthens the muscle, then muscle mass. So how it improves the muscle mass? It decreases the cortisol, then mitochondrial function, anxiety, increase the focus, concentration, better muscle recruitment, and the coordination. So there is phytochemical, the details are also mentioned. That is vitolide, a glycol 0.65%. Then how it is actually basically preparation of the test. So Withania somnifera extract 500 milligram per kg dissolved in the distilled water and administered orally to the experimental rats. So basically, you can these are the about the Withania somnifera. Then we will come to other group. So we have seen the first group, which is the Withania somnifera. We have seen all the details given by the author. Then there is a protein cocktail and the whey. Then there is a provide the necessary amino acids and the required for the muscle protein synthesis. So protein cocktail. So we'll see what author has given the detail about there. Uh, Amongst the five group, this is the second group. So this is the quinoa and the soybean. So what is the difference? So this is the quinoa is the slow release protein, anabolism and repair of the muscle at the rest, where the soybean is fast release protein, deterioration of the muscle after injury, trauma, wear and tear after the exercise. So here the all nine amino acid in quinoa acids, and it boosts the muscle growth. And here the arginine and leucine, that is for the muscle formation. It is rich in leucine, but soybean is having phytic acid as well, that is antioxidant and anti-inflammatory. Then there is another group which is the whey protein group, which is the fast release protein containing all amino acid required for the muscle buildup. So we are seeing one by one the group chosen by the author. Then there is a resistant training, so where there is a no exercise. So resistant training is any physical exercise, so muscles are contracted. Then there is a rapamycin complex pathway. Then it stimulates the protein synthesis to build the strength and resistant. In what the method they have used in resistant training, so in first week they allow the rats to swim without the weight for 10 minutes, 10 to 15 minutes. In second week, 5 gram forced swimming with the weight of 5 gram. They are forced to swim 5 minutes up to the 15 minutes. Gradually increase from 5 to 15 gram for the swimming period of the 15 minutes, empowering the weak aging muscle. So basically, this is the another group, that is the resistant training group. Then the whey protein. So basically preparation of the test, like we have seen about the Withania somnifera. So here the whey protein powder. So soybean and quinoa were roasted, cooked till soft, mixed and made into the bolus and fed to the aging rats. The whey protein powder was dissolved and in the distilled water administered orally to the reference group of the rats. So we can see here total calorie, total fat, total protein, dietary fiber, total carbohydrate. So here are all the details mentioned by the author. So we are seeing one by one group which is designed by the author in this research paper. So basically animals. So here the male sprue Drale rats are used. It is housed in the cages, control environment, humidity 50 plus minus 5%, 12 hours light, 12 hours dark cycle, 25%, 25 degrees Celsius plus minus 2, 7 days of acclimatization. Animals were provided a standard diet to feed and the drinking water. So basically, we have seen the species of the rats. So basically, experimental procedure. So here you can see we have seen already how the control group is made and how the compared group. So you can see here that is Withania somnifera, then Withania somnifera plus quinoa, whey protein. So accordingly, there is a grouping. So control group and the compared group, and the chow diet and drinking water, that is standard diet, is maintained during the experiment. Then the introduction and outcome measures and the results. So this is very important part. So oxidative stress, that is, basically oxidative stress, low protein intake, AMPK enzyme, low grade chronic inflammation, and insulin resistance, hyperglycemia. So oxidative stress can result into the reduced muscle protein synthesis, mitochondrial dysfunction, and there is a muscle atrophy. And the markers, the tests are LPO, then GSH, SOD, CAT, and ROS. So these are the tests. Then low protein intake in diet or due to the impaired protein absorption, it result into the muscle weakness, and total protein are assessed. So AMPK enzyme, suppression of the muscle protein translation and the synthesis. There is a diminished skeletal muscle growth and muscle atrophy. So AMPK levels we can see. So low grade chronic inflammation affects the mitochondria adversely. It results in the muscle atrophy, IL-6 that is interleukin 6, then TNF alpha and CRP. These are the inflammatory markers we can check. Then insulin resistance and the hyperglycemia. Hyperglycemia, muscle strength and the function. Then there is a muscle protein metabolism, muscle protein loss and the strength, insulin assay and blood glucose level. So basically we can see biochemical estimation and the assay. So all this is result into the sarcopenia. We can see all this result into the sarcopenia.
Is everything okay, Dr. Jyoti?
Yeah, yeah, I just want to charge. Yes. Sorry for interruption.
It's okay.
Next slide. Next slide. Yeah. So the results. So all treatment successfully attenuated aging, elevated glucose, CRP, IL-6, and TNF alpha, AMPK, and the BAX levels. The significant restoration of aging depleted total protein levels, glutathione, then superoxide dimutase, calatase, BCL2 was noted in the treatment group. An increase in the grip strength and the greater bicep mass. The WSE means that is Withania somnifera extract plus protein treatment elicited the best result. That is the result mentioned by the author. So now this is the first part where in short I tried to explain about uh, 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 the about the paper. So let me come to the second part of my presentation, that is a critical analysis. So here I will speak on the two parts. The first is 3R. 3R are the principle of good science designed by the scientists to improve the animal welfare and the scientific accuracy as it is in vivo study, and arrive guidelines, that is good reporting in the in vivo experiment. So this is the the paper published by the uh, 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 Cincinnati. So he actually, it is all about the the improving the muscle strength. So there are this author has actually covered everything except this decreased hormonal level. Then there is they can actually take these points into the consideration while working on the during aging, the muscle loss or the sarcopenia. So there is decreased hormone levels, decreased protein synthesis, stress oxidative damage, mitochondrial alteration, excitation contraction uncoupling, increased apoptosis, progressive decline in energy intake, increased level of inflammatory cytokine, altered heart shock protein response, and impaired muscle regeneration. So I have highlighted the 3 points where the author can consider these things as well, and but still maximum points were covered by the author. So this is the reference from which I'm talking about this points. So I will go to the next slide. I'm talking about 3R. The another one is the refinement. So refinement is like what sort of environment, how we take care of the and which species we use during our in vivo study. So males pro dolly rats are how in the house cages, controlled environment. We are seeing these things. So all the temperature, humidity, everything is diet, including the diet, is well maintained by the author. Then we have seen the refinement, then we'll come to reduction. So based on the statistical analysis, each group has 6 rats and there are 7 group, 5 the compared and 2 control group. So total 7 groups. So it is 42 total rats are there. So in reduction, I would like to have this, like to understand using as few animals as possible to get good result based on the statistical analysis. Each group has 6 into 7, that is 42 rats. So whether all these 7 groups are necessary, what is the rationale behind combining the dietary nutrition with Withania somnifera? Are this combination are necessary? If we see the result, all the compared groups show the same results. There is no much difference because we have seen the result as well. So there is author is not mentioned any difference in the results. So in the definitely we can see among the three are that the reduction part that we can use the minimum, the animals for our study. Then there is a replacement. Strong justification why animal is selected. This is about the paper. There are this reference is actually uh, it is from the author itself. That is, the study has reported an extract of Withania somnifera to improve the muscle function and recovery in the adult males engaged in the resistance training for 8 weeks. On consumption of the Withania extract, significant attenuation of the muscle marker, which had built up the bloodstream on exercise induced muscle damage in these males, was noted along with the decrease in the body fat. So this is the reference given by the author itself in the research paper. So why animals are selected? There can be alternative. This is about the 3R. We have seen this 3R. This is some literature study I have did for the Withania somnifera. So you can see there are I have find total 13 papers. So age group is generally, if we see the age group, it is all between 18 to till 45. But in this paper, the author is actually after 40, and mainly the research work is 50 onwards. So that is also the my query that uh, means why after 50 only, because all the research paper are except last three. So going through the clinical trials, most of them are carried out to look at the muscle strength in the middle-aged population, which is I think so need of our as well. So there is like we have seen the age group, but in the when I did the literature study, so I has found that Withania, they have in the conclusion part they have mentioned that Withania somnifera has a significant reduction in the stress level. Withania somnifera reduces anxiety levels. Withania somnifera is sleep quality of life at the physical and psychological levels. So basically, all these things are actually, in depth mentioned when it comes to the Withania somnifera, that is ashwagandha. So study involving age population were all looking at the effect of Withania on the senile problems such as sleep and the anxiety. This in the study, which included aged animal, assess the sarcopenia by the administration of Withania and looking at biochemical parameters. This in turn helped to better understand the mechanism of action of Withania in prolonging the changes attributed to the muscle due to the aging. So it is just focus on the muscle, but there are uh, good research about the stress, sleep, and the anxiety. But all these things are not in the conclusion or the discussion part by the author. So outcome measures. So outcome measures are the grip strength, blood glucose level, total protein, inflammatory marker, AMPK. We have already seen this glutathione, antioxidant enzymes, and the bicep brachii muscle histomorphological study. So most of the procedures employed in the study can be done in the human trial, except histomorphological study. Otherwise, all these tests are possible in the humans as well. So why the rats? That question definitely there in my mind. Then ashwagandha can safely be given in the humans, as there has been some critical clinical trials. So a question to ask: it could not be done in humans. So that is also the important, because there are, I have already mentioned during the literature study about the 13 research paper that I that is there on the various prestigious journal about the ashwagandha. why males to rats are selected for the study. So rationally behind it. So it can be the food chain. It take lesser energy. The level of conscious and the pain of and the suffering they undergo is much lesser as compared to the other lower animals in the chain. Life cycle is less. The strain of albino rats used widely for the experimental purpose because of the calmness and the ease of handling. And there is again uh, the the research work I find about the when it comes to the muscle strengthening or aging of the muscle. So muscle stem cell, so that is nothing is mentioned about the muscle stem cell. I have given the reference about in the last slides. I have given all the reference about the terms I'm using about the Vithania. So muscle stem cells are like a very burning topic, and there are lot many work is going on, but in this paper there is nothing mentioned about the muscle stem cells. So I think so that will be well suited for this study, and that can give a good contribution as well. So we have seen that resistant training and how the protein intake. So in resistant training, we have seen the control and compare group. So I have find that total protein among the resistant training group, where they are forced to swim the rats, so there the total protein is very less, and there is no justification and discussion or the conclusion part. Then uh, this is the again like I came to the arrive the guidelines. So there basically you can see the cause. There is a reduced muscle protein synthesis, low protein in the diet, impaired protein absorption, lack of the exercise. So this can be the cause. Then intervention, muscle protein availability that we have seen, that is Vithania somnifera, and effect is the strengthen the weak and the aging muscle. So some points are missing, like food, the fecal material, body weight assessment should be done in such studies to check the impaired protein absorption. So impaired, like we they have mentioned in the cause about the impaired protein absorption, but all this the points are missing. How much of food intake, how much of the fecal output, and how much of the increase in the body weight. So these the points are missing in the conclusion part. Then objective, this study evaluates the Vithania somnifera and some dietary intervention to combat the muscle weakness in the aging rats. So basically everywhere there is a word used by the muscle weakness in the aging rats. But in the conclusion, the author has mentioned the muscle mass strength, then the power of the muscle, then the muscle weakness during the aging, retain the skeletal muscle functionality. So muscle, in discussion, they have, mentioned muscle atrophy, muscle weakness, muscle strength, muscle function, muscle degeneration. But in the title, there is only one thing mentioned, that is the muscle strength. So I feel that rather than the muscle strength or the muscle weakness, we can use the word sarcopenia, because that is that cover all these things. Then in conclusion part, they have missed the Vithania itself. They have just mentioned the right diet, including protein, antioxidant, and resistance. Exercise is the key for the muscle weakness during the aging and retain the skeletal muscle functionality. So Vithania somnifera is missing in the conclusion part. I think so. That is the big, the missing part in the conclusion by the author. Then these are some minor things which I noticed during the paper study, that on day one, like initially we have seen that, like they have mentioned day one, day 14, day 28, day 42, and day 60. So it should be, like day one, day 15, thereafter day 30, day 45, and 60, as they have, in material and methods, they have shared these things. So here also in this part, there is they have, you know, this, they have mentioned about the Vithania somnifera and the plus whey protein, but actually there is a, that is only a separate, you know, whey protein is the separate group. Vithania somnifera is not, that is protein cocktail, and the Vithania somnifera is the one group, but whey protein is completely a different. They have not mixed Vithania somnifera but with the whey protein, but here they have given the results. Now I will like to come on the Arrive guidelines. So amongst the Arrive guidelines, it is for the in vivo study. So exact number, how many units, and why they have chosen total number of the experiments of the rats, and how the sample size is decided, and how it is calculated. So these things are, you know, missing while coming to the sample size. And is my sample size is large enough? So these are some questions for the Arrive guidelines. So here I would like to, yeah, so here I would like to come about the Arrive guidelines. That is, definitely we can do reduction. Can we do reduction rather than using this many groups and plus two controlled groups of the age, you know, like 12 months to 12 months onwards and 12 months less. So two control groups. So is it really necessary? Can we do reduction in the sample size? So that is the one, you know, that comes under the Arrive guidelines. Then I will come to the inclusion and exclusion criteria. So there is no specific inclusion or exclusion criteria mentioned by the author. So like age, weight, strength, there is no detail are available you know, while reading the paper about the inclusion and exclusion criteria. Then there is randomization and the blinding. So randomization and blinding. So what is the need of randomization? To avoid our choice, many groups like seven, there are, so better to do randomization. Randomization is basically to avoid the unnecessarily, you know, having so many groups in the study. So these things are, you know, so I feel that randomization and blinding should be done. So not to utilize R&D and BLD are more likely to report a difference between the study groups rather than the studies that employ these methods. So basically, to avoid our choice many groups, there are better to do randomization and gives value to the study. And the blinding, measuring, the person should not know the treatment given to the animal. Then the resistance exercise, grip strength, measuring with the grip strength meter. So these are all, you know, like blinding is not, this randomization and blinding is not like up to the mark. So, in my opinion about this research, that is, the data clearly points out the advantage of adding ashwagandha, that is Vithania somnifera. The data clearly points out the advantage of adding ashwagandha, that is Vithania somnifera hydroalcoholic extract, along with the protein cocktail for increasing the muscle mass in aged rats. This demonstrates the potential for application in elderly humans. The discussion on the mechanism of action is well formulated on the basis of rigorous review of previous work. 7 out of 10 mechanisms which are contributory to the aging process are addressed in this paper. The research question is not clearly defined. Then the profile is relevant. Phytoconstitution of Vithania somnifera could have been included as was done for the quinoa and whey protein and soya. Yeah, this is a very, because we have seen the phytic acid, then the leucine, arginine, so nothing mentioned about the Vithania somnifera. Forget about the Ayurveda aspect, that is Rasavirya Vipak and Rasa Rakta Maansa Meda Majja. But even the phytoconstitution is not mentioned. Not followed Arrive guidelines, which is very important for in vivo study. then need justification for the animal study when human study is feasible, because there are n number of research uh, paper are already available about the safety in human of the Withenia somnifera. Then, when multiple groups are involved in animal study design, does not inclusion of each group require proper justification? That is, we have seen under the 3R, that is the reduction. The discussion and the conclusion are not formulated adequately with the reference of the finding. That also we have seen a statement of adverse the statement on adverse effect, limitation, and the bias could have been included. So no adverse effect, what are the limitation during the study? So these things are missing in the research paper. While reading this research paper, uh, I would like to thank organizing team that they have provided me this platform, and I will especially have gratitude towards Pratibha ma'am, that she has that trust and that I can be the member of the journal club. This is my first presentation for the journal club discussion. So whatever uh, uh, plus points or whatever the contribution I can did or for this presentation, that is all mine. Whatever the mistakes that whatever the mistakes, so kindly I ask for the your like suggestions, and so I can improve myself in this. Like basically I'm a physician, but definitely research is my interest area, so I would definitely like to improve myself. So namaste everyone, thank you.
Thank you, Dr. Jyoti, for the beautiful presentation. And there are no mistakes in researches. We just advance, advance, and learn. Uh, we really thank you for coming to our platform and presenting and sharing your experience. This recording will be available and uploaded on YouTube, and we will be welcoming more presentations from you. And we are glad to have you on the platform. Thank you so much. And good night in India and good afternoon in US. Thank you. Bye bye.
Thank you. Bye.